Ciao, bentornati. Hello and welcome back to Richard Harris's Herbal Tutorials. The tutorials that inform and educate about the practical and common sense usage of herbs and natural substances. The tutorials that teach you how to identify and use plants and other natural agents, why you should use them, how to use them, when you should use them, and when you shouldn't. In these tutorials, there are practical and common sense guidelines indicating their uses. These guidelines are given in every video, so whenever you watch these videos, pay attention to the categories under which the herbs or natural substances are placed to better understand and apply them. I'm Richard Harris. I have been practicing Ayurvedic and traditional Chinese medicine for over 3 decades. I've helped many persons over the years using many of the substances I have highlighted in the many podcasts I have done. I'm not here to sell anything. I'm not here to hype you out. Your ears and intelligence wouldn't be assaulted by unfounded claims. If you're looking for information that makes sense, if you want information you can trust, you're watching the right videos. Stay with me until the end, for this is not just another video on herbs and natural substances, but a reliable guideline that may help you from making decisions that may affect your health in a negative way. On the other hand, if you want your ears tickled, if you're looking for miracles, if you're excited and supercharged whenever you see several persons waving different plants and extolling their magical usage, you're watching the wrong podcast. However, you're still invited to stay. These videos are overflowing with beneficial information, and you may find something that is useful for you. Okay, the introduction is over. Let's move on to the interesting part. Settle yourself. Sit tight and chillax as we once again take off on another herbal magic carpet ride to discover some more of the wonderful healing agents that were created for us and were so lovingly and conveniently placed all around us. In this podcast, I'm introducing a new agent known all over the world as the eel. That is the freshwater eel, Anguilla rostrata. Yes, you're right. I'm speaking of that slimy, snake-like looking fish, normally found in ditches, swamps, ponds, trenches, and mangroves. This particular eel is native to North and Central America, and even in some parts of South America and in many of the Caribbean islands. However, they're not the only species found in the Caribbean, and they're not the only eel used for food or for medicine. I've selected this species because it's easily found in the Caribbean, but most species of freshwater eel basically serve the same purpose. Known as shanyu in China, Asians' demand for this prized delicacy and medical panacea. Yes, it is seen as such in the eastern part of the world. There the demand for them is astronomical. Most of the eel eaten in China is farmed, while much of the eel for the Japanese market is imported from America and other places. Excessive exploitation of this resource has resulted in overfishing and a vast reduction in stocks of this eel in North America, resulting in urgent calls for the conservation of the species. We have them in the Caribbean in large amounts. Here is a valuable source of income. Before you continue, if you're finding this video helpful, and if you're new to the channel, please hit the subscribe button and the notification bell. You don't have to do so, but I'd be very happy and grateful if you do. Also, your subscription will serve as a powerful motivation for me to produce more of these educational videos. There's an old adage which states, one man's meat is another man's poison. This is a truism. There are so many different types of food eaten and loved in one part of the world, and they're ostracized and scorned in another part of the world. Many of the herbs we in the Caribbean cut down and discard disdainfully are eaten and very much appreciated in other parts of the world. The eel is one such food. We in the Caribbean don't eat it, or we hardly do, but it is a highly prized delicacy in China, Korea, Singapore, and particularly in Japan. Do you know that the famous sushi that is loved so much is oftentimes made with eel meat called unagi? That's news for you sushi eaters. The eel is very highly prized as a superfood and is very expensive. When we look at the chemical structure, we can see how nutritious it is. Eel belongs to the class of drugs known as drugs that tonify blood and cheat. A few videos back, I did a video discussing this class of drugs. So before proceeding further, let me refresh your memories about this category of substances. Agents that tonify blood are customarily used in blood deficiency syndrome. First of all, blood in Western medicine is not the same as blood in traditional Chinese medicine, though they may overlap. Now, before you deem me as mad and as a quack, or think that I'm losing it, let me explain. Blood in the West is the red liquid that runs through the veins. It's identified anatomically. Chinese medicine identifies blood functionally. Thus, it's not identified in a location, but by what it does. For this reason, TCM identifies blood disorders that Western medicine doesn't, and vice versa. Traditional Chinese medical thinking postulates blood is made by the spleen, stored by the liver, and circulated by the heart. Blood is also thought of as having the function to nourish and to moisturize. Let's think of blood as the oil in your car. The oil function is to nourish, so to speak, and to lubricate the various components of the engine. The oil is changed when it loses its viscosity, and hence its ability to moisten. This means the engine can have enough oil, but not proper lubrication. So fresh oil is needed. In TCM, blood works the same way. So one may possess the standard level of blood in Western medicine and considered to be deficient in blood in TCM because it's not moisturizing. Symptoms seen may be dry skin, dry hair, dry mouth, scanty menses, etc. Again, using the standard in the West to measure blood volume, a patient may be considered as having adequate blood volume. But in Chinese medical thinking, he or she may be considered as anemic because in spite of the fact that the volume is enough, blood isn't going to the foot or the head or hand in the right quantum. Symptoms seen may be numbness of the foot, brain anemia, forgetfulness, sudden fainting, dry gangrene, just to name a few. To elaborate further, in Trinidad, there may be lots of rain, but the people in Laventille are without water because the infrastructure or distribution is inadequate. The result is plenty water in various locations, non-elevative. This illustration may be likened to a case of enough blood in allopathic medicine, but blood deficiency in traditional Chinese medicine. As we can see in Western medicine, blood deficiency is spoken of in terms of volume or insufficient red blood cells, etc. In TCM, blood deficiency is identified by the inability of the blood to perform its function of nourishing and moisturizing. In TCM, blood deficiency is identified by the inability of the blood to circulate properly, to perform its functions of nourishing and moisturizing. Blood deficient patterns therefore manifest symptoms of blurred vision, exhaustion, numbness, brittle nails, pale tongue, itchiness, vertigo, infertility, little sperm. This is where these podcasts are miles apart from other uploads relating to herbs and herbal medicine. Here you have theory, diagnosis and practice, and common sense. The substance used are formulated along the same lines with the problems manifesting. So there's blood deficiency, the herbs and substances are classified accordingly. We have drugs that nourish blood. There's wind disorders, there are drugs to move wind. There's toxic heat, there are herbs to detoxify. So back to the drug we're discussing, the eel. The parts of the eel used is the whole fish is gutted and cooked. Energy and taste. It has a warm energy and a sweet taste. Organs and meridians affected: stomach, spleen, lungs, kidneys. Chemical constituents: amino acids such as leucine, lysine, valine, glycine, glutamine, arginine. Minerals such as phosphorus, magnesium, calcium, iron, potassium, sodium. Vitamins: B1, B2, B6, vitamin A and vitamin D, omega-3 fatty acids. Its functions are: 1. To tonify blood and chi. It's considered as specific for convalescents. 2. It strengthens tendons and bones and dispel wind dampness. 3. It invigorates blood circulation and relieves pain. Uses: the eel is thought of as having tremendous medicinal value and is often used in foods to treat a variety of debilitating conditions, such as malnutrition in children, severe anemia, sexual debility, chronic fatigue syndrome, post-operative issues, and as a rejuvenator for the elderly and infirm. Pain and weakness of the lower back and knees, postpartum urinary issues, weakness after chemotherapy or radiotherapy, anal fistula, arthritic pains, rheumatism, tuberculosis, postpartum hemorrhaging, bleeding hemorrhoids, dysentery with bleeding, wounds difficult to heal. Externally, the slime is used topically for healing wounds. That is after sterilization. Fractures and joint pains. Dosage: 150 to 300 grams in food. Note: for those interested in eel but feel squeamish about eating it as a food, products made from the eel may be bought online. There you can find pills, capsules, serums, gels, sprays, etc. Or you can make your own products. First, the eel must be gutted, cleaned, sterilized in an autoclave, dried, then made into powder. We have come to the end of another magic carpet ride into the natural substances kingdom. It was a joyous occasion sharing this information with you people. You make me feel like having some eel soup with ginseng or babande. Sorry, I can't share this one. It's too valuable. When I chew, you may swallow. It's the thought that counts. Please remember to like, share, and comment. Your comments are highly valued and will be replied to. Reluctantly, I have to go. But as usual, I'll be back soon, once it is Jehovah's will. Meanwhile, stay good. Ci vediamo prestissimo. We'll see each other very soon. Ciao, ciao.